So you've had a chance to hear from James. I don't know that he needs much more of an introduction than you already had. Now Stephen, on the other hand, is an interesting gentleman. I got to know him a little bit last night over dinner. What I didn't know about him is that my wife's a commercial pilot, and she grew up flying Cessnas, and her dad owned a Cessna. And Steve used to work in Wichita, Kansas, the headquarters of Cessna. And he had an unruly job of helping the layoff process and consolidating operations in a very prestigious, but sometimes very volatile industry. And he became somewhat of an expert in the process side of things. And he took that expertise and developed a company. And now this company provides that expertise to a lot of other people, and we want to have him share with us some of that. So we're going to invite James back up here, and the new panelist, Stephen. And Monica, is there an order in which they're going to present their case study? James is first. So James, why don't you come on up, and then we'll have Stephen come back up afterwards. All right.
Well, thanks again. So we'll get into a little bit more of the nuts and bolts of the social enterprise that we started. Employer resource networks, really what that is in general terms is when I was a VP of HR for a manufacturing company, we had some business issues we were trying to solve, but we didn't have the critical mass by ourselves to deal with them as far as working with employees. And so an employer resource network, or an ERN, was really a framework that we created that brings together several companies, for-profit companies, to identify common issues that they're struggling with, and then trying to work together with nonprofits and government entities in the community to design a new solution or modify an existing solution and offer it in a different way. So Employer Resource Network is really that framework of bringing those three sectors together to, one, ideate around what is existing in the community and where are the gaps, and then, what would a new solution look like if we were to start with the problem within the workplace and engineer something backward to the partners in the community, as opposed to the traditional method of starting with a nonprofit coming up with an idea or a product or a service, and then going to employers and trying to convince them that they need that as a consumer. So when I was a VP of HR at Butterball Farms, I took over executive leadership in 2000, and when I did that, we had about 300 employees. And when we did the W-2s in January of 2000, we had 1,800 W-2s for 300 employees, so 600% turnover, about 25% of our workforce. And so we had a serious problem, and we looked at what could we as a for-profit company do to solve that problem. We weren't social workers, so we couldn't do life skills training. We weren't really large enough to do that type of stuff on our own. So we had a serious business problem, and we very quickly realized that by ourselves we couldn't solve it. We couldn't solve it because we didn't have the critical mass, but we also didn't have the expertise. So we thought the CEO and myself went up on the top of the plant, and we said, well, there are a dozen companies right around us. I wonder if they're dealing with the same issues. And so we convened a meeting with our peers, and we found out from the HR folks that all the companies had a very similar problem with employees coming to the companies, and then because they had issues, transportation, daycare, things in their personal lives, that they wouldn't show up for work and then they'd get fired. And And so, we could change our policies, or we could try to find a way to change that dynamic. So what we did was we looked at who in the community had the expertise, and we tried to understand where did the system fail. Why weren't we getting good employees at the key? And so, we worked with a convener, Delta Strategy. Priscilla's sister Penny was working on a poverty reduction initiative. And so she convened a group around employer practices. We had several employers. We had the workforce system. We had the Department of Human Services, we had the community college, and we looked at what did the existing system do as far as getting people ready for work, how long could they support somebody once they were employed, and what were the issues that the employers were facing once that assistance fell off. And so by understanding the system, we could identify where the gaps were. And so we looked at most of the workforce development systems, if somebody were to come through the system, they would get a job, and they have some wraparound services for about 90 days. People coming out of generational poverty had problems that came up, well beyond those supports falling off. And so that's what the cause of the turnover was. So we looked at, okay, what is the Human Service Department doing about it? And we found that they couldn't really do much because the caseworkers had about 600 individuals on their caseload. So they may be working with somebody on transportation or daycare, but they didn't have the time to really work on providing those services in a very effective way. They only had like 15 minutes a month to really work with an individual on barriers to employment. So what the companies did was they partnered with the Department of Human Services, and they took a caseworker out of the Department of Human Services and brought them on site so that they were at the place of employment. By changing the location of that caseworker, we were able to focus them on retention, and we were able to get the employees the services they needed in a very proactive way. So where somebody may have a transportation as an issue to getting to work, they were able to access that service at their place of employment, and then they were able to have that result so that they could maintain employment. The state's average of people recipienting that kind of public assistance was about 55% of people that went to the workforce would reciprocate that kind of cash assistance within a year. And by having a caseworker on site at the employer, we're able to get about a 98% retention rate. So where we had 1,800 W-2s in that year, the next year we get it down to about 380 for the same population. So, looking at the issue within the workplace was where we started. We looked at how do we change that, and we saw that we had a business problem, but we needed a social solution. So by creating that partnership, we couldn't do it internal to the company because so we couldn't do it within the company, nor was it a core competency of the companies. But what we could do is we could create this social enterprise where each of the companies could become an investor in this process. We could contract the staff through a nonprofit or through the public sector. And so what we did was we created this employer resource network called The Source. So each company had an ownership stake. We didn't want to rely on government funding because it's not reliable. And as a for-profit company, we didn't want to share information with the government any more than we had to. We figured that if we were going to change this, we as employers had to take a leadership role. And so when we formed the group, the initial 8 companies that formed the initial ERN became the board. So they sat on the board, they looked at the way the program was designed to make sure it was meeting their need, and then they worked with the partners to look at how can we get the best out of the services and resources that they had to affect the change. So I think another critical piece was, instead of the relationships being outside of the organization, by doing as much as we could within each of the companies and locating the service on site, we could allow the case managers, which we labeled success coaches, to take away the stigma of kind of the clinical nature of case management. By putting it on site, we were able to develop relationships and relationships of trust, so that when an issue arose, the employee felt like they could go talk to somebody. And it wasn't HR, because HR, oftentimes people didn't trust that HR wasn't going to put something in their employee file or wasn't going to be able to help them. So the other difference was the individual success coaches could really look at the presenting issue, but then also look at getting to the root cause to try to help the individual understand why they were in the situation they were and to try to affect change. So by doing that, we could, again, the caseworker or the success coach could ask questions that HR couldn't for liability issues, but we were able to change the way that they access resources and they were able to support themselves. So, so what we did was, when we looked at the needs of each of the companies, we did some analysis to understand the demographics of each of the companies. The companies, because they were the investors, determined what the metrics were, because the public system tracked things that didn't matter to employers. The employers had to set the metrics as to what was important and then track them. And much like a company who implements a process internally, they're going to drive the performance of that process to make sure that it's profitable by having them involved in the social enterprise and being the primary investors. Whenever we ran into an issue, we would marshal the knowledge of the partners at the table to try to, again, make improvements. So if something wasn't working, it wasn't thrown out, but it was again, evaluated to make sure that it was meeting the needs of the company and employees.